Hey guys, welcome back to RN.themes. Our previous video stressed about the management of hypertension. Today I just wanted to give an overview of what a student, not especially, should know about hypertension in general. So if you have to write about hypertension, what are the things you need to focus on? So I won't go deep into each of the things I'm about to talk about. So I'm just giving an overview, like I said, but I'll be excluding the pathophysiology because it's something that needs more explanation. So let's start with the definition of hypertension. So if you were to talk about hypertension, the first thing you need to know is what is hypertension. Even a layman will tell you that is elevated blood pressure or high blood pressure, high BP. But you need to include that it's sustained elevation of arterial blood pressure or consistent. So it's not that something you get once, no. So that term is very important. Then you talk about the range. What is the normal range? When will I say that someone is hypertensive? That's you need to know. An adult should have, let me say, average of 120/80. Then you talk about the etiology and the risk factors. So the etiology is very into two: primary or essential hypertension, and then secondary hypertension. So primary, the etiology is unknown, so there is no known cause. Why etiology results from underlying disease condition. There is someone with let me say some endocrine disorder can have hypertension, so that is secondary. So then the risk factors, we can group it into modifiable and non-modifiable. Modifiable in the sense that it can be changed. So those ones include something like obesity, your lifestyle like smoking, alcohol use, sedentary lifestyle, high intake of sodium. Those are modifiable. Then the non-modifiable are the ones that cannot be changed, like your age, you can't change your race. Like hypertension is more common among the African descendants. And then hereditary or genetics, you can't change your gene. So most people, it runs in their family. So the next thing you need to talk about is your assessment before you talk about management. How do you assess? One important thing you need to know as a nurse is accurate blood pressure measurement is very important, because if you measure wrongly, you are going to intervene wrongly. So you need to select the appropriate cuff size, correct position of that cuff. I need to ensure that your patient is well rested. It's not someone that's finished jogging or finished jumping from the gym. You come and measure his or her blood pressure and say it is high. The person should be well rested, sitting down, and shouldn't be talking before you measure. And like I said, accurate cuff size. Don't use a pediatric cuff on an adult or vice versa. Then the next thing you need to do is monitor for any sign of organ damage, like headache, change in vision, any chest pain, loss of breathlessness or shortness of breath, like any change. And again, I don't want to talk about the laboratory investigation. Then the management you'll be focusing on. The first line of management of high blood pressure, hypertension, is lifestyle modification. That's the first thing. So under that lifestyle, you cannot talk about lifestyle modification without talking about the DASH diet. That is the dietary approach to stop hypertension. So it's focused on the diet, and mostly fruits and vegetables, whole grains. So those are the things you educate the patient on a healthy diet to take. Then talk about if the person smokes, educate about smoking cessation, limiting alcohol use, trying to lose weight if the person is obese. So those are the first things that the person needs to do before we move onto the pharmacological management. That is the medication. And that's when the ones we've talked about previously, like the AC inhibitors, the beta blockers, the diuretics, the alpha adrenergic blockers, and the rest of the medications, which I won't be going in depth. So, but I'll be talking about your nursing responsibility on a patient that is on those medications. One, you need to monitor the side effects. It's very important, because if the person is exhibiting a side effect of a particular medication, and that's why you need to know your medication. and monitor for any side effects and intervene when necessary or when needed. Next thing is encourage adherence. Most patients, they don't adhere to medications, especially all these long-term medications. So you need to encourage adherence. And again, patient education is very important. And another thing that we don't always take into consideration is follow-up. Follow-up is very important. Most patients, they only come back when they are down, when they're like physically ill. So if you ask them to come back the next 2 weeks, they don't come. So you need to encourage your patient that they need to come for their follow-up, for them to be checked as maybe is in next 1 month or next 2 weeks as needed. So you need to encourage them to come even when they don't feel that they are ill.